Hello everyone, hope you're doing well today and welcome to our webinar. This presentation is a culmination of a health tech series of research, content, white papers and campaigns we've been putting together on Zudu side to help grow and foster the great community we've been building in the health tech space. We have some familiar faces on the call today and also some new faces, so I'm hoping you all find this useful. Please feel free to jump in and ask questions throughout or add them to the chat panel. We do really like to encourage some interaction throughout and also have some time to answer questions at the end. And feel free to get in touch with us to learn more about what we do as a business and also how you can continue to be a part of our community. By joining the webinar today, you also get the webinar recording, so we'll send you that afterwards. You also get a copy of our health white paper, so that features kind of additional information of some of the topics we're covering today. You also get a PDF brochure of our app development journey document, or how we develop apps as a business, and also a free digital audit of your presence and looking at potential growth opportunities as well for your business. So just touching on us first of all, just to introduce our business, we are an award-winning digital agency based in London and Dundee here in the UK, and we specialise in creating digital experiences. We develop successful products and provide digital transformation consultancy across many different platforms and technologies. I'm the CEO. I founded the business back in 2014, and now we've grown to a team of over 30. And we work across a whole wide range of different industries. And these are some of the awards that we've won, accolades over, I think, just the last sort of 12 months. So yeah, we're very proud of what we do, and also just proud of being at the forefront of some tech innovations that are coming out of several different industries with a key focus on the health tech sector. So some recent projects we've worked on include things like GPS-enabled functionality, secure in-app chat, NFC triggered events, and connected technology through stuff like Bluetooth Low Energy. We do AI-powered analytics dashboards and lots more. We will walk you through a couple of examples of projects we've worked on just as we're walking through the content today. But we've worked with organisations all over the world, with the likes of NHS, Asahi, Weir Group, and companies like Aviagen as well. So some notable organisations, both in the UK and internationally. And across a wide range of different industries, but we do tend to specialise on niche industries such as the health sector as well. So yeah, today we're going to walk through digital health effectively. So we're going to talk about how digital health is sort of impacting the health space, and we're going to go through 6 different topics. So looking at AI and improving patient relations, we're going to look at wellness and support and hybrid services. We're going to look at IoT and connected devices. We're going to look at the role of remote care and self-care. Also going into big data, privacy and security, and then finally landing on AR and VR. But we're just starting on a quote here. So 49.3% of patients noted they had a more positive experience with their care provider when using digital health technologies. So it shows how important that is to patients. And we'll go through a few examples of how opinions are edging towards being quite positive in everyday digital tech being involved in healthcare. So first of all, we'll take a look at artificial intelligence. So this is quite a massive area, and the industry itself is worth 14, or estimated to be worth 15.4 billion US dollars this year, and it's forecasted to be 208.2 billion USD by 2030. So it is a huge area across the world. Also, big data is allowing all these AI science models being fed with much more intelligent information as well, which make them much more efficient and can provide much more accurate results as well. So it's actually progressing quite quickly, and much more quickly than previous estimates as well. And AI is now a kind of everyday use, ultimately, in a lot of systems, and you might not even know that it's sitting there in the background. So really, some examples here are kind of out of clinic services to inpatient care, the data security, fraud detection, and error reduction across common procedures. And also healthcare staff have said that AI can help them reduce things like time spent on admin, time spent on writing reports. Patients would also receive more valuable contact time, because tech can take a lot of the weight of that, and also waiting times can be reduced as well. So patients were also prescribed better treatment plans through AI, which improved success rates and recovery time, and walk through a few examples of that. And it's not just all about the admin. There are some very impressive kind of research and systems being implemented across healthcare. So over the past 4 years alone, things like analyzing brain scans, looking at doing that 1,000 times faster than before, looking at using machine learning to identify early stages of dementia, providing doctors with a better understanding of lesser known conditions, comparing that across big data effectively, and reducing pressure on doctors to memorize conditions on their symptoms, and also reducing the chance of misdiagnosis. And obviously, with the COVID-19 pandemic, the AI has played a major role in looking at the accessibility of healthcare, offloading kind of lengthy tasks that could have been conducted manually before, and also looking at things like looking at screening and virtual assistants, and also looking at kind of, and we'll go into that in a bit more detail a little bit later, in terms of remote care as well, and self-care. So it takes a lot of weight off the services, which really be and have been quite overburdened, I guess, as a result of the COVID-19 pandemic. We actually had the opportunity of working with NHS, and we built a COVID-19 self-check for outpatients, which was used to sort of self-check against COVID symptoms, and it would generate a unique pass to be able to take in for those outpatients, to be able to take in to the hospital to prove that they've gone through the process of checking their symptoms. That's a very simple algorithm in the background to calculate whether they should either stay at home or be able to come into the hospital. And it was used by hundreds of thousands of patients across the Tayside area in Scotland here. Virtual assistants can also make services more user-friendly for people with disabilities. and they can be made compatible with a range of assistance technology. So virtual assistants and chatbots, you might call them as well, can be very, very helpful. And research also suggests that customers or patients are demanding this type of technology now. So the healthcare is one of those things that's very overwhelming for people, and some people find it quite complicated. Some people, stay at home. They don't go out and actively seek care, and that's one of the key challenges of healthcare. And this research study suggests that 83% of respondents found that poor communication was the most challenging part of their patient experience, and tech can help improve that. So this same survey looked at some examples of tech tools that could help improve the situation, such as ways to communicate with healthcare providers that don't require in-person appointments. Also, reducing waiting times and improving self-care methods as well. Access to personal medical records. Scheduling software for appointments, that's quite a common thing now that has only come in the past couple of years, particularly in the UK services. Also automated reminders about appointments, and access to lab results online. So all this can be driven by technology, and there's lots of different systems that are coming into effect here. Wellness support, and so the next topic we're going to go into is wellness support and hybrid health services. So just starting on another research conducted there, looking at 40% of respondents had improved their digital skills since the beginning of the pandemic. So in this situation, due to COVID-19, a lot of people were coming on to using more technology, getting used to technology, and this alleviated some of the pressure. So we certainly recognize that as a business as well, people were more used to coming online and using remote software to either work or do client meetings. And people were becoming more digitally savvy and tech savvy. And also this opened up a big opportunity for hybrid health services. So this looks at things like home workers, looking at kind of stress and anxiety. So things like that could be alleviated through software platforms, and we've worked on a few that help do that. We'll take you on to a few examples. There are things that COVID-19 presented as well that looked at affecting people in certain ways, and things like extended wait times for patient appointments, and also dangerous weight gain. So you might remember sitting at home, eating a lot of food, and there was a lot of software that we started to develop, and we saw the demand side of things, where people were trying to develop new techniques and software to help improve and alleviate those concerns from people working from home. So AI-driven apps are helping people prioritize their health in a way that is more compatible with the 9 to 5 workday, as well as reduced waiting times for any help received. These are a couple of examples that we've worked on as a business. And some patients also reported that over 100 minutes per visit could have been saved by not having to commute as well. So we worked on things like parish nursing and the Dundee Recovery Roadmap in Dundee, which help people find wellness and support services. So looking at removing the stigma associated with people seeking help, and that received quite a lot of press. I think we won an award for that app as well. We're also working with things like DNA Pal, and we launched their mobile app, which looks at monitoring or taking DNA samples and providing some self-care advice in terms of fitness and diet and general health plans to help people learn about their DNA and how that kind of reacts to people's behavior effectively. So health and wellness apps are quite a big area that's certainly come about. We've seen on the demand side of things, we've seen quite a big increase in demand for health and wellness as really companies and people working from home, they've started to prioritize that in their minds, and there's been a lot of sub-services and products and businesses coming out as a result of that. And so let's take a look at IoT. It's one thing that we've worked on quite significantly. So looking at how medical devices are kind of connected to software and apps, and how that's relating to data being gathered on systems. So first of all, biosensing wearables, you might have used a Fitbit before, or an Apple Watch, or a Google Health Watch. They've been increasingly in popular demand as the barriers to entry have reduced. So prices has come down on those items, most of them anyway, and it's also reduced the barriers to access for the majority of the population. So that combined with things like 5G, so it's increased connectivity. So it's allowed these sorts of devices to become more connectable to other devices to help track and utilize that data. So you can really take advantage of these super fast internet speeds and have that data linked into lots of different things, lots of different systems, hooking into your phone, hooking into other algorithms and backends effectively that can provide quite insightful data off the back of it. So when calibrated correctly and used correctly, these devices can look at things like monitoring your heart health, looking at tracking oxygen levels, blood sugar, looking at irregularities in users' vitals. You can also save data and look at those reports, and they can be sent to healthcare providers. So it provides an element of self-care as well, and more intelligent to healthcare providers to actually make a decision or give the correct advice. Also looking at reporting incidents, we've worked on a few apps, and an example we'll walk you through in a few slides, looking at how that relates to people being able to kind of self-care and monitor health in a better way, and also looking at automatically calling emergency services, for example. So there's lots of different examples here in biosensing wearables and fitness trackers that can do a lot of things, and software apps, web apps, and back-end software can help analyze that data and provide collective intelligence to the users and healthcare providers. So when it comes to connected devices, it's important to consider things like the size of the device. We've worked quite extensively with clients looking at how big those devices could be. You don't want those devices to be big and bulky. If it's a wearable, it needs to be light and agile, and that's one thing that has been achievable in the last few years to make these quite these devices quite light. Looking at battery life and charge time, obviously with any device that you do have, you don't really want it to have to be charged a lot. So a lot of the time when you're creating healthcare devices or wearables, ultimately you would want to look at that battery life and make sure that it can be drawn out as long as possible without having to recharge or replace the battery. So also how disruptive that is to a patient's day. That's quite an important piece there. So if a wearable is really disruptive and it's taking a long time or longer than it would otherwise to do that task or get that information, ultimately it's not achieving the purpose that's set out to do. So it should be simple. Wearables should be simple, whether that's something that's a device that goes on your inhaler, or if you're an asthma patient, or a watch. So it's the replacement of your everyday watch, which also provides more intelligence. And also how the data gathering makes the user feel. Sometimes people, and we'll go into data and security in a few slides, sometimes people can feel quite insecure about sharing their personal data and where that personal data goes and how that's tracked and then fed back to the users is quite important. Also, a final quite often overlooked aspect there is design and usability. So that's quite an important piece of the development process that we usually have in projects. So we're thinking about, okay, how is this going to be really usable for that individual? Design and usability are very important when you're particularly when you're introducing new health tech wearables into the market. So we're always looking at kind of reducing that frustration in apps, and it can cause a lot of abandonment as well. So if apps cause users frustration, it does suggest that that rate can go up to as high as 90%. So really the goal there should be to make these apps simple, effectively to use, and almost like you don't have to put any energy behind it, but also get a good benefit off the back of it. So one example we've worked on recently is QIoT connected asthma. So they were shortlisted for a digital transformation award as well. This was a device, so it was for asthma patients to monitor their own health, effectively looking at stats and charts, being able to kind of self-monitor. We also had a device that would connect to the inhaler, so it would track how many puffs you were taking on the inhaler, and also tracking that against things like pollution and pollen. So looking at feeding all that into the smart engine that looked at tracking that data over the population, where people were using their inhalers, also feeding that back into in an anonymized format back into the healthcare system to help learn and adapt as well, and also allow patients to be able to send that data to their doctors or healthcare providers, so they can be provide more intelligent feedback to help them monitor their health in a better way, where they were having attacks, for example, and what type of medicine to potentially advise them to take at that point in time. So next topic is the role of remote care and self-care in digital health technology. So one of the biggest things that is kind of an issue that we learn from the healthcare providers that we work with is patient compliance. So it's the insurance that patients are regularly taking the proper medication and following the prescription prescribed by their doctor. So you might have been in this situation yourself when a doctor provides a certain medication and you forget to take that as regularly as they say. And then it also may not then have the effect that it should have, and that's a big issue. But also on the other side of it, there's things like patients not turning up to appointments as well. We talked about scheduling software, and also software that can help reduce the load on waiting times, and also make sure people can get to the point they need to get to as quickly as possible through technology. So a recent survey looked at revealed that 93% of patients would use digital health technologies to stay on top of their prescriptions and manage refills, and 91% said that a digital health approach to healthcare would help them remember and stick to their appointment times. So just looking at the NHS there in 2021 alone, they lost £288 million due to the over 9.6 million appointments that were not attended due to the pandemic. So this is a huge amount of efficiency and time and subsequently money lost, as well as a result of missed appointments. So, for example, looking at the previous project, we looked at QIOT. That is a smart way of alerting patients when they are due a refill. And the next evolution of that is to automatically link in with pharmacy providers, so they can get automatically mailed a refill when the inhaler reaches a certain amount of or a reduction of capacity, I guess. A survey of patients from the UK, Italy, Sweden, and Germany looked at the overwhelmingly positive feedback for those who actually engaged in digital health tech during COVID-19. This is a big opportunity, and results showed that 49.3% of patients noted a significantly more positive experience with their healthcare provider. Only 40% had a neutral experience, and only 10% had a negative experience. So during the pandemic, a lot more people were interacting with digital software. Research has suggested that I think this was a survey conducted over 6,326 patients, and looked at how much of a positive impact that actually had on patients. So patients seem to be demanding, and they want more tech in the process. Those who had the negative experience, so you always need to be careful in this scenario as well. And one big thing that we pay a lot of close attention to is the capability to access software as well. So you need to be very careful when you're creating software and you're saying this is the only way of doing things. Some people might not be capable, or they might not have the devices as well to access that software. So some people might have difficulties using software, and you always need to take that into account. Also, some people noted, those 10% with the negative experience noted that there's a lack of purpose-built regulated software options, and also a lack of interest in digital technology amongst older age groups. But one other area we focus on as a business in terms of digital adoption is e-commerce, and a lot of people were forced into buying things from home, and what we saw with particularly older age groups as well was that the digital adoption rates were much higher, So older people are getting much more comfortable in using day-to-day technology, but it also doesn't remove the reason behind having alternative methods as well for people. And so when technology is integrated into the patient journey efficiently, it can lessen the load on healthcare and emergency service providers as well. This can allow patients to access to online support, can look at minimizing the avoidable service use. We talked about that massive loss on the NHS in terms of missed appointments, reducing emergency service call-outs for cases of genuine emergency. Particularly in the NHS, they do have NHS 24, which is designed to be a service of reducing the strain that puts on the subsequent services that might be delivered. Looking at lower wait times for urgent appointments by reducing calls to the healthcare provider, also providing more capacity for in-clinic services to treat patients, and reducing time spent on filling in post-appointment paperwork as well. Technology can so a lot of people fear technology, and they say that's less personalized, but actually it can provide a more personalized and potentially even a gamified experience as well to help engage users with their treatment plan. And we've worked on quite a number of solutions that help gamify and reward people as they go along. There's one app that rewards people called My Sugar, that looks at the glucose levels for diabetes patients, and that looks at providing people with better understanding, but also rewarding people for their usage of the app as well. So there's lots of smart tech out there, and there's ways to engage people through healthcare apps, and also ways to increase engagement as well that help make people feel better about self-care, but also reduce the loads on healthcare services. So some conditions can also make self-management of symptoms without outside support more difficult. Movement disorders and neurological conditions can be particularly difficult for the patient to manage alone. We recently worked with Ravencourt to develop the safer walking apps. So that was a physical device that was for dementia patients to wear a physical device, and that would facilitate the tracking of that patient, and also detect things like falls as well. So it had there's an SOS feature as well that allows the tracker device to call their carer directly and have a two-way conversation as well to help make sure those patients are safe, but also facilitate an element of self-care as well. So that would allow those patients to have a bit more maneuverability and not have to be stuck at home all the time, for example. So similar technology has been used by companies to track a worker's location when commuting to remote areas, or even by students on night outs to ensure their safety of their peers as well. So obviously we're talking a lot about AI, and that probably wouldn't be as effective without things like big data. And also there's concerns around privacy, security, and that's been something that's been quite critical in recent years, as well as attacks have increased. So Just a quick statement there. So research is suggesting that the cure for cancer may lie in big data. You might have heard stories of people like Steve Jobs looking at matching DNA against other cancer treatments to look at what might have the biggest success. And that's really just one example of many that can help people have more tailored services as well, to help treat cancer in a better way. But with so much extra patient data being collected and made available to different stakeholders throughout the patient's healthcare journey, the important issue of privacy and security is often brought up, and a lot of people feel a little bit uncomfortable about that situation as well. In a survey by Accenture, 38% of patients had concerns around data and data security in relation to technology. So over 14.7 billion was spent on cybersecurity in 2019, and that's projected to increase to 58.4 billion in 2030. And we did see due to COVID-19, there was a big uptake in medical industry, the technological uptake there. But the industry still remains a big target for big data breaches. So that was over the 12-month period since the beginning of the pandemic, 53% of healthcare providers experienced data breaches, malware attacks, denial of service attacks, and more. 51% of the time, those attacks result in loss of data alongside financial losses and operational disruption there. So it's a big issue, and with the more data and more systems you're using, it's important to think about that data security side of things. Artificial intelligence, encapsulates a very broad range of opportunities, but it should be used to kind of, and healthcare providers should try to preempt data breaches. So with the use of AI, it demands more data being used, and systems need to be secure in order to prevent hackers breaching that data and also abusing data as well. So AI technology can use current and historical data to look at analyzing normal traffic across networks and flagging suspicious activity, looking at exposing vulnerable and improving systems long term, becoming a powerful tool in fighting breaches, and also helping prevent data corruption or loss. But the pure adoption of cybersecurity technology by healthcare providers has been cited, and there's nowhere more prominent than the NHS, which has had some very serious data hacks and breaches over the last few years, and it's become quite an aggressive area of focus for hackers as well, to try and get that data. So last topic here we're going to talk about is AR, VR, and metaverse capabilities in healthcare. Metaverse is obviously quite a new area as well. AR, VR, it's been around a lot longer, and actually the three collide a lot in many day-to-day services. So it's worth kind of mentioning them under one umbrella. At present, the VR market is worth approximately 12 billion, and it's expected to grow to 87 billion by 2030. Research conducted by PwC found that people learning on VR were able to complete their training 4 times faster than their colleagues. VR learners were 40% more confident in their skills, and VR learners were also 35% more capable of acting on what they'd learned. Additional VR courses in large classes proved to be more cost efficient, achieving a saving of 52% to stand in comparison to standard e-learning classes. So VR can provide a lot of capabilities here, and it helps things like muscle memory, and looking at educating people as well in ways that they'd only really been able to do through live classes in previously. So it's really adding a lot of capability to training, and also being able to do things remotely as well. We'll walk through a couple of those examples in the next couple of slides. So a great example of AR medicine is the Novarad's first ever FDA cleared surgical system called OpenSight. So that actually looks at people at augmenting looks at augmenting visuals onto a patient to be able to then so they use Microsoft HoloLens smart glasses to be able to see stuff before they're actually while they're doing it internally in the body. So this really is kind of really cutting edge stuff. And these capabilities are changing the face of what's possible in healthcare. There's also examples of being able to conduct surgery remotely, or assess people remotely as well through AR and VR. So we'll just watch a quick video showing the capabilities of this system. There we go. So pretty impressive stuff. There's also just the last slide here before we jump on to any questions. There's also numerous physical and mental health benefits to patients of all ages using VR and AR technology. Things like sports and coach-led VR and AR exercise programs, like Supernatural and Fit XR. Using gamified experiences to help people engage. Also, more important as people are working from home and being at home more, to be able to improve mental health and physical health. There are also programs available for kids looking at things like Endeavour RX, becoming the first FDA authorized video game for treating ADHD in children aged 8 to 12 years. So the game's developers reported a 68% improvement in children's behavior after 2 months of using the app. So it just shows how great these things can be, and some of the tech evolutions that are coming out of AR, VR, and metaverse. Brilliant. So that's the end of the slideshow. So I'll open up to kind of any questions that anyone has. Feel free to get in touch. Always happy to have a chat, and feel free to connect with me as well on LinkedIn. We are always happy to talk about anything we've talked about today, and connect, and I hope you've enjoyed the content today. And so yeah, hope you have a great day, and we will hopefully catch up soon. Take care. Bye bye.